Well, thank you. It's a pleasure to be here. I had the privilege this morning of spending time with the advisory group, and it was quite an exciting conversation and gave us a sense of some of the things that are in fact possible. What I'm going to give you today is kind of a payer's point of view of what's going on, and talk a little bit about what we envision from a perspective in terms of health reform. Give you what we see is the case for increased collaboration overall in the system, summarize, and then open it up to a few questions. I do want to start out with what we at Aetna always start all of our discussions with, which are really the values of the company. And last year I gave 220 talks to our employees. We have over 35,000 employees. Every conversation we have with our employees start with the values of the company, which start with putting the people who use our services at the center of what we do. And we define customer in a non-traditional sense, in the sense that it's not the economic transaction, because that's often the plan sponsor or employer or the union, or in some instances an individual. We think about the customer as the person who you spend time with as an Aetna employee. So it may be a hospital, it may be a physician, it may be a plan sponsor, it may be a member or patient. And so we always start with this whole notion. In the context of who we are, and just a little bit of familiarization, we have over 35,000 employees. We serve almost 37 million unique Americans. So more than 1 in 10 Americans has a relationship with us. About 19 million of those have our medical products. Some have our dental, our behavioral health, our pharmacy, and other types of products that we have. So we really have a very strong brand, and we're active in all 50 states. We have provider networks that include just short of 1 million relationships. We contract with over 5,000 hospitals, and of the 5,000 hospitals we contract with, we actually provide health benefits to about 10% of them in the context of having relationships to be their health services provider. In terms of the medical spend that we have as a company, this year we will purchase healthcare services in the tune of $60 billion would be our market spend for both our fully insured business as well as for our self-insured customers. Now, I want to talk just briefly about how our business model has evolved so far and how we think it will evolve in the future. And I think if you ask most people who don't really follow the industry what we do and how we do it, what they think about are really all the transaction-based services, claim processing, the B2B marketing of selling to other businesses, and then building networks and negotiating contracts and discounts with you. As we moved into the early 2000 period, what we began to see was the creation of the whole health savings account, health reimbursement account products. We began to see the use of the web and the internet in terms of a portal, and we began to see version 1 of the disease management, case management, kind of what we called the vaporware or the brochureware, where people got a brochure that said, you've got this condition, here's what you need to do. The next phase really began to focus on transparency, high-performance networks, wellness, and health advocacy. Now, the one message I think is important for you to understand is that transparency is coming to you. And transparency means that a member will one day be able to go online, enter in the hospital that they're going to see, where they're going to have a service done, enter in their physician, and understand precisely how their health benefits will apply to that experience, what their rate is, what their copayment, what their cost sharing, and how the hospital performs on critical quality metrics. And so that is an inevitable trend, and it is inevitable because the clients we spend time with, like GE and others, expect it, demand it, and are going to make certain that it happens. And I think one of the things that Aetna is a little unique is that of our membership, 2/3 of our clients are Fortune 100 clients. So we work with the most sophisticated employers, and they are unrelenting in terms of making certain we're doing the types of things that will make a difference to them.